You're watching this video today because you have been told that you have heart failure, which is a very common problem in the United States. In the past, we have called this congestive heart failure, as many people have fluid retention and symptoms of congestion. Heart failure means your heart isn't able to pump enough blood to meet your body's needs. Over time, conditions such as coronary artery disease or high blood pressure gradually leave your heart too weak or too stiff to fill and pump efficiently. Heart failure is a chronic medical condition that usually requires lifelong treatment. It is possible to lead normal, active lives even if you have been diagnosed with heart failure. Many people do so because they have learned to closely manage their own care. Taking control is the key to success with your heart failure. Your care is not just the responsibility of your doctor or nurse. In fact, the success of your treatment plan depends on your active participation. Having heart failure requires you and your family to work closely with your healthcare team. Today, we are going to focus on the heart failure zones to ensure you get the information you need to help you become an active participant in the management of your heart failure. We have developed a treatment plan that you should try to follow every day. First, let's talk about weighing yourself. Checking your weight is key to keeping an eye on your symptoms. Weight gain is one of the first signs of fluid retention. Purchase a bathroom scale if you do not already have one. Make sure that you can see the numbers on the scale. Do not be concerned if your weight on your home scale does not match your weight at your doctor's office. Weigh yourself in the morning after you empty your bladder, and weigh before eating or drinking, and always weigh in the same clothing or no clothing. Use a calendar, notebook, or log to track your weight and keep it by your scale. The goal is to recognize a change in your weight before you develop swelling or other symptoms. Often, increases in weight can be easily dealt with by changing your diuretic or water pill. Medicines are important in the treatment of your heart failure. Research shows that heart failure medicines can help stabilize your heart function. With the proper medicines, in the right doses, and with careful management, you can live longer and feel better. Take your medicines exactly as directed, and do not take any over-the-counter medications without asking your doctor first. Many cold remedies, herbal products, and some pain medicines called non-steroidal anti-inflammatory medications like Advil, ibuprofen, or Motrin may worsen your heart failure. Monitor for symptoms of fluid retention. This would include trouble breathing or shortness of breath, or swelling in your feet, ankles, legs, or stomach. Ignoring symptoms is risky, and it is better to tend to your symptoms as soon as they begin. Remember, we want to help keep you out of the hospital and have a good quality of life. It is important to follow a low sodium or salt diet. People with heart failure need to limit their salt to 2,000 milligrams a day. Fluid and salt are chemically attracted to each other, and where one goes, the other follows. If you eat too much salt, your fluid pills may not work as well. Here are some simple steps to cutting down in your sodium. Lose a salt shaker, choose low sodium versions of your favorite foods, and pick foods that are naturally low in sodium, and always learn to read food labels. Try to balance activity with rest. Learn to conserve your strength and pace yourself to prevent fatigue. On the other hand, it is important to get regular physical activity. Start slowly and steadily increase your activity level. This may be a good time to get involved in a cardiac rehabilitation program. Fatigue is a common problem for people with heart failure. You may be surprised to learn that the best treatment for fatigue is physical activity. The green zone is your goal and means all is clear and stable. Your symptoms are under control. Remember, you may have some heart failure symptoms every day. An example is shortness of breath when you climb a flight of stairs, and this would be your baseline green zone. Generally, this zone means your symptoms are under control for whatever is normal for you. Often in the green zone, you have no unusual shortness of breath, no weight gains more than 2 pounds, and no swelling of your feet, ankles, legs, or stomach. The yellow zone is a warning zone. It is important to keep track of your heart failure symptoms so that you can recognize when they are getting worse or whether you are developing new ones. Here are some of the early symptoms of worsening heart failure. Gaining 2 to 3 pounds in one day, or a weight gain of 5 pounds in 1 week. If you have not yet developed a plan with your doctor about adjusting your diuretics for a weight gain, or plan to be seen in their office, please talk to your doctor as soon as you can. If you are more short of breath than normal or feel swollen, fluid may be building up. A persistent cough or a feeling of chest congestion could mean you are retaining fluid. Fluid retention may make it harder for you to breathe when you are lying down. You may feel the need to sleep sitting up in a chair or propped up with several pillows, and this is a sign of worsening heart failure. Fluid retention in the abdomen may cause a loss of appetite, a feeling of nausea, or a bloated feeling. And lastly, confusion or weakness may mean your body isn't able to pump enough blood to meet your body's needs. The red zone is for emergencies. As you already know, heart failure causes many symptoms, and some of them are more serious than others. It is important to recognize when you should call 911 for emergency help and when you should call your doctor or nurse for urgent attention. The following urgent symptoms should prompt you to call your doctor immediately: increased shortness of breath or a new shortness of breath while at rest, waking up suddenly at night due to difficulty breathing, a need to sleep sitting up or on more pillows than usual, fast or irregular heartbeats, palpitations, or a racing heart that persists and makes you feel dizzy or lightheaded, or a feeling like you may pass out. Call 911 for emergency help if you have any of the following symptoms: chest discomfort or pain that is not relieved with rest or nitroglycerin, severe, persistent shortness of breath, or if you have fainted or passed out. By the time you leave the hospital, a treatment plan will be made for you. Make following your treatment plan a permanent part of your life. Plan ahead. Stick to a routine for your diet, exercise, and for taking your prescriptions. This requires attention to details and active planning. Plan for prescription refills. Allow extra time for food shopping so that you can read food labels. Schedule time for physical activity. Planning ahead gives you a little extra room for success when those unexpected events happen.